Hi, I'm Dhriti Mandhyan. Today's video is on frozen shoulder. Frozen shoulder is basically a condition characterized by pain and stiffness in your shoulder joint.
The shoulder joint is classified as a synovial ball and socket joint. It involves articulation between glenoid cavity of the scapula, that is shoulder blade, and the head of the humerus, that is upper arm bone. The shoulder joint is not a single joint, but a complex arrangement of bones, muscles, ligaments, and tendons that is better called the shoulder girdle. The joint capsule is very loose, that's why it gives a limited interface of the humerus and scapula. Therefore, it is the most mobile joint of the human body. The socket of the glenoid cavity of the scapula is itself quite shallow and is made deeper by addition of the glenoid labrum. The glenoid labrum is a ring of fibrocartilage that runs around the cavity of the scapula in which the head of the humerus fit. The labrum deepens this cavity and effectively increases the surface of the shoulder joint. There are 4 muscle groups in the shoulder. The rotator cuff muscles are the subscapularis, the supraspinatus, the infraspinatus, and the teres minor. The bicep tendon complex also helps keep the humeral head in the glenoid and help raise the arm. The scapulothoracic muscle attach the scapula to the thorax. Frozen shoulder is the result of thickening and shrinkage of the joint capsule, which causes tightening of the tissue and further inflammation and stiffness around the shoulder joint. The shoulder joint is made up of 3 bones that form a ball and socket joint. They are your upper arm, that is humerus, shoulder blade, that is scapula, and collarbone, that is your clavicle. There's a tissue surrounding your shoulder joint that holds everything together. This is called the shoulder capsule. The shoulder becomes frozen when the capsule protecting the glenohumeral joint contracts and becomes stiff. With frozen shoulder, the capsule becomes so thick and tight that it's hard to move. Bands of scar tissue form and there's less of a liquid called synovial fluid to keep the joint lubricated. These things limit motion even more. Therefore, the friction increases. When the shoulder becomes immobilized, the connective tissue surrounding the glenohumeral joint, the joint capsule contracts, losing its normal capacity to stretch. Trying to avoid the pain caused by moving the shoulder leads to further contraction of the capsule, which causes inflammation of the surrounding soft tissues. In critical cases, bands of scar tissue may form.
The causes of frozen shoulder could be primary, which is idiopathic, or secondary, which includes
Shoulder causes. These are the problems directly related to the shoulder joint, which can give rise to the frozen shoulder are fractures and dislocations present around the shoulder. Non-shoulder causes. These are the problems not related to the shoulder joint, like diabetes, cardiovascular disease. The reason could be prolonged immobilization of the shoulder joint due to referred pain. If you have hormonal imbalance or weak immune system, you may be prone to get affected by joint inflammation.
Now let's come to pathology. It involves when a person is doing repeated overhead activities which causes strain and it results in inflammation around the joint capsule, making it thick and stiff.
The main symptoms of frozen shoulder are pain and stiffness that make it difficult to move. If you have frozen shoulder, you'll feel a dull pain in one shoulder. You might also feel the pain in the shoulder muscles that wrap around the top of your arm. The mobility of the shoulder joint is also reduced. A patient with frozen shoulder clinically presents a decreased range of both active and passive shoulder movement. The patient demonstrates a capsular pattern of movement. Pain is noted at the end stage of the stretch. Accessory joint play is also reduced. Resistive tests are generally pain-free in the available range of motion. Patient is unable to do routine daily activities. Patient complains of acute pain, decreased movements, external rotation followed by loss of abduction and then forward flexion. Internal rotation is least affected. Clinical features: frozen shoulder typically develops slowly in 3 stages. Freezing phase: in this, pain is felt in the shoulder that worsens at night. Stiffness occurs, it lasts for about 2 to 9 months. In frozen phase, less pain is felt. Stiffness occurs while performing, especially external rotation. It lasts for approx 4 to 12 months. Last is thawing phase. In this, a gradual return of range of motion is seen. It lasts for 5 to 24 months. Signs and symptoms typically begin gradually, that worsens over time and then resolve. It takes about 1 to 3 years. Pain distribution and severity: strong component of night pain, pain with rapid or unguarded movement, discomfort while lying on the affected shoulder. Pain can easily be aggravated by movement. Pain can be anywhere from the base of the skull, from down the arm into the hand. Aggravating activities: limited reaching, particularly during overhead or to the side activities. Patients also suffer from restricted shoulder rotations, resulting in difficulties while clothing, brushing hair. Another common concomitant condition with frozen shoulder is neck pain, which is mostly derived from overuse of cervical muscles to compensate the loss of shoulder motion. The patient should not perform any further activities which increases the pain in the shoulder joint. For diagnosis: to diagnose frozen shoulder, passive and active movements are performed to differentiate and determine the level of stiffness. A physical exam is usually enough to diagnose frozen shoulder, but other imaging tests like X-ray or MRI are done to rule out other underlying problems. In X-ray for frozen shoulder, sclerosis may be seen. A complete physical examination includes inspection and palpation, assessment of range of motion, and strength testing. Apley scratch test. This test is useful to assess shoulder range of motion. In this test, abduction and external rotation are measured by having the patient reach behind the head and touch the superior aspect of the opposite scapula. It helps to assess the range of motion of the glenohumeral joint. Treatment involves counseling, medications that could be NSAIDs, intra-articular steroids. Surgery and other procedures includes arthroscopic surgery, joint distension. It's a procedure of injecting sterile water into the joint capsule that can help stretch the tissue and make it easier to move the joint. Shoulder manipulation. In this, the patient receives a general anesthetic. The patient becomes unconscious and feels no pain. Then the shoulder joint is moved in different directions to help loosen the tightened tissue. Physical therapy. The physiotherapist first will evaluate the stage of severity and degree of pain and stiffness based on patient diagnosis. After that, the treatment protocol is set up as per the patient requirements. Modalities are used. They aim to reduce pain and improve function via an increase in energy, like TENS and ultrasound machine. Manual therapy. For frozen shoulder, moist heat or ice packs, soft tissue mobilization, stretching, and joint mobilization are important, but should be performed with the aim of increasing the efficiency of shoulder joint. Modalities and manual therapy help to increase circulation, reduce swelling, and loosen the tightened tissue. Manual treatment protocol for frozen shoulder. Warm up the upper quadrant with light to medium pressure. Deep work to the muscles of the glenohumeral joint. Moist heat followed by stretching. Great for joint mobilization, then repeated stretching. Use ice if appropriate. Work on other upper extremities as well. Progressions. Manual techniques and exercise should only be progressed as the patient irritability reduces. Patient response to treatment should be based on their pain relief, improved satisfaction, and functional gains, rather than restoration of range of motion. Progressions for stretching via dynamic splinting is based on patient tolerance level. If the patient experiences discomfort or stiffness lasting for more than an hour after splint is removed, the duration of treatment is reduced for the next 2 stretching sessions. Splinting technique has shown a progressive result for treatment of frozen shoulder. A splint is a medical equipment which is used to stabilize the injured body part. 3 things that you should not do while splinting are: never stick items under your splint to scratch the skin. Second, do not use oils or lotions near your splint. If the skin becomes red around the edge of the splint, you may pad the edges with a soft material. Importance of patient education. For treatment of frozen shoulder, patient education is essential in helping reducing frustration and encourage compliance. It is helpful to give quality instructions to the patient and create an appropriate home exercise program that is easy to comply with daily activities is critical in relieving symptoms. Guidelines. Avoid meat, butter, cheese, and milk as that will increase inflammation. Intake of raw fruits like cherries, papaya, pineapple, as they contain proteolytic enzymes, which in turn helps to reduce inflammation. Intake of omega-3 fats. Take 2 tablespoons of flax seeds powder daily. Starting to strengthen. As your range of motion improves, add rotator cuff strengthening exercises. Be sure to warm up your shoulder and do your stretching exercise before you perform any strengthening exercise. A good warm-up is essential to limit your chances of injury. Warming up also helps the body to deliver oxygen to the exercising muscle group. It helps to increase body temperature, which reduces the chance for muscle and tendon injury. A 5-minute warm-up increases blood flow to the exercising muscles. In order to prevent frozen shoulder, it's important to keep the shoulder joint fully moving. The purpose of warm-up is to strengthen and prep the muscles and help them stabilize and maintain proper position. It enhances the mechanical efficiency and power of the exercising muscles. An appropriate warm-up prepares the cardiovascular system for upcoming physical activity. The physical therapy first focus on exercises that help to stretch the joint capsule and later on strengthening exercises. The exercises that help to increase the mobility of your shoulder joint are: first, pendulum stretch. Relax your shoulders, stand and lean over slightly, allowing the affected arm to hang down. Swing the arm in a small circle, about a foot in diameter. Perform 10 revolutions in each direction, once a day. As your symptoms improve, increase the diameter of your swing. When you are ready for more, increase the stretch by holding a light weight in the swinging arm. For cross body reach, as shown in the picture, use your good arm while sitting or standing to lift your affected arm at the elbow, bringing it up and across your body, exerting gentle pressure to stretch the shoulder. Hold the stretch for 15 to 20 seconds. Do this exercise 10 to 20 times per day. Next is towel reach. Hold one end of a 3-foot long towel behind your back and grab the opposite end with your other hand. Hold the towel in a horizontal position. Use your good arm to pull the affected arm upward to stretch it. You can also do an advanced version of this exercise with the towel draped over your good shoulder. Hold the bottom of the towel with the affected arm and pull it toward the lower back with the unaffected arm. Do this 10 to 20 times a day. For armpit stretch, by using your good arm, lift the affected arm onto a shelf about breast high. Gently bend your knees, opening up your armpit, and then straighten. With each knee bend, stretch a little further, but don't force it. Do this exercise 10 to 20 times a day. These exercise helps to increase your endurance level by providing oxygen and nutrients to your tissues. For finger walk exercise, face the wall 3/4 of an arm's length away. Reach out and touch the wall at waist level with the fingertips of the affected arm. With your elbows slightly bent, slowly walk your fingers up the wall spider-like until you have raised your arm as far as you comfortably can. Your fingers should be doing the work, not your shoulder muscles. Slowly lower the arm and repeat 10 to 20 times a day. Flexibility helps to prevent injury, improve posture, balance. A positive state of mind provides greater strength, improve physical performance, and causes less pain. Outward reach exercise. Hold a rubber exercise band between your hands and your elbows at a 90-degree angle close to your sides. Rotate the lower part of the affected arm outward 2 or 3 inches and hold for 5 seconds. Repeat 10 to 15 times once a day. Inward reach exercise. Stand next to a closed door and hook one end of a rubber exercise band around the doorknob. Hold the other end with the hand of the affected arm, holding your elbow at a 90-degree angle. Pull the band toward your body 2 or 3 inches and hold for 5 seconds. Repeat this exercise 10 to 15 times once a day. It is very important for patients with a frozen shoulder to avoid re-injuring the shoulder tissues during rehabilitation program. Patients should avoid sudden jerking movement or heavy lifting with the affected shoulder.
With that, we come to the end of this topic, frozen shoulder. I hope this video was helpful. Thank you.